Inflammation and cancer. In this short video, you'll discover some exciting new understandings of what promotes cancer and why free radicals and inflammation is so dangerous. You'll also explore some awesome new solutions that are very empowering. If you know anyone with cancer, or if you want to prevent it, you will find this video very intriguing and helpful. What do we know? Inflammation and oxidative stress, which is free radicals, are associated with virtually every chronic disease, and inflammation is involved in cancer promotion. In this scientific paper entitled Inflammation: Gearing the Journey to Cancer from 2008, the authors conclude chronic inflammation plays a multifaceted role in carcinogenesis, and that mounting evidence from preclinical and clinical studies suggests that persistent inflammation functions as a driving force in the journey to cancer. Another paper from 2009 entitled Inflammation: A Driving Force Speeds Cancer Metastasis. This is important because metastasis is the major cause of cancer mortality. They also state that the inflammatory component is present and contributes to tumor proliferation, angiogenesis, metastasis, and resistance to hormonal and chemotherapy. Interesting. And then this current paper from 2013 entitled Redox: Inflammatory Synergy in the Metabolic Syndrome. What that really means, redox is really free radicals in the metabolic syndrome, and that's pre-diabetes, if you will. What these authors stated was, left unchecked, cross-promotion of oxidative stress and inflammation creates a feed-forward cycle that can initiate and advance disease progression. And such redox inflammatory, or let's just call it oxidative stress and inflammation, is evident in the pathogenesis of obesity, insulin resistance, type 2 diabetes, cardiovascular related issues, and is hypothesized to be the common soil from which they develop. So inflammation and oxidative stress is the common soil where all these other diseases develop from. Another paper from 2013 entitled Oxidative Stress Associated to Dysfunctional Adipose Tissue, that's your fat tissue, a link between obesity, diabetes, and breast cancer. What did these authors conclude? Inflammation induces an increase in free radicals and subsequently promotes oxidative stress, which may create a microenvironment favorable to tumor development in obese persons. They also stated that obesity-induced inflammation promoted by adipose tissue, that's your fat tissue, is a key feature, and it's thought to be an important link between obesity and cancer. Interesting. Your fat tissue does not just sit there, it produces oxidative stress and compounds, and this may be a link between obesity and cancer. And another current paper from 2013 entitled Oxidative Stress Specifically Downregulates Survivin to Promote Breast Tumor Formation. A quote that they have is that oxidative stress promotes the progression of ER+, and that's estrogen receptive positive breast tumors. And also, their conclusion, our data therefore suggests that downregulation of this special protein called survivin could be an important early event by which oxidative stress initiates breast tumor formation. And one more paper. In this paper entitled Oxidative Stress and Antioxidant Defense from 2012, they state that oxidative stress contributes to many pathological conditions and diseases, including cancer. And in this paper entitled Cardiac Dysfunction and Oxidative Stress in the Metabolic Syndrome, an update on antioxidant therapies. They stated that the mechanism underlying cardiac dysfunction in the metabolic syndrome, which again is like prediabetes, are complex and might include all these assorted physiological changes and increased oxidative stress. That's the important underlying common soil or common ground where obesity, diabetes, cardiovascular disease, and cancer may be related. So therapies aimed to reduce oxidative stress and enhance the antioxidant defense system have been employed to reduce cardiac dysfunction. Wow, this is a lot of information. And that ties down to this current paper entitled Increased H2O2, and that's hydrogen peroxide. So increased hydrogen peroxide levels in exhaled breath condensate in primary breast cancer patients. Why are we talking about this? So instead of doing invasive testing like blood testing or biopsies, there's now evidence to show that, and this paper said it, that this is the first study to demonstrate increased hydrogen peroxide in exhaled breath condensate in patients with localized breast malignancy and its relation with clinical severity. That's a lot of big words. What this really means is they can now measure for markers in exhaled breath that can be related to localized breast cancer. So let's summarize all this information, because that was a lot of technical information and maybe a bit boring, but it's very important. And what is our summary? Chronic inflammation and oxidative stress promote cancer. The metastasis of cancer is what kills us, and that's when the cancer cells spread and invade other tissues in the body. And inflammation and oxidative stress promote metastasis. That's a key point. And diabetes, obesity, the metabolic syndrome, which is kind of, as we're saying, like a prediabetes, cancer, are related and cross-promote each other through inflammation and oxidative stress. And further, therapies aimed at reducing oxidative stress and enhancing antioxidant defenses are vital. And early intervention and testing for oxidative stress and inflammation is important. And measuring for oxidative stress in a breath test is accurate, it's fast, it's low cost, and it's easy for patients and clients. So what can you do? You can be tested for elevated or high levels of oxidative stress and inflammation. The blood test for oxidative stress is a little pricey at about $300, and it requires a blood draw. However, there is now a simple and low-cost in-office test to measure for oxidative stress, and it's available to you. And this new in-office test highly correlates with the blood test and is a simple, fast breath test, and it's very low cost. It's often around $30. Testing for oxidative stress will help you better address the root cause of cancer and other chronic diseases, diabetes, cardiovascular disease, and so on. As cancer affects so many families and friends, please help us out and forward this video on to them. Thank you. And please remember that you can come in and be tested for oxidative stress.